Welcome to this edition of Living Well, making the most of your senior years. I'm your host, Terry Troyer. The COVID-19 pandemic has impacted each and every one of us in many different ways. On today's show, we'll review some of the health issues that seniors face and that the pandemic is making even more difficult. We'll help you prepare a fall prevention plan because we don't want to complicate our lives, especially right now, by falling and injuring ourselves. We'll get some information about our eyes, how they're changing as we get older, and the best ways to prevent eye problems and vision loss. We'll take a break from the chilly temperatures with our fitness guru, Val Collins, who has some tips on how to make your time in the pool fun and healthy. And because so many people are feeling the negative effects of isolation during the pandemic, we'll get some valuable information about depression. But first, for lots of older people, a good night's sleep is just a dream. And the stress and uncertainty of the pandemic is making a good night's sleep even more elusive. First is trouble falling asleep. Then they wake up after only a few hours. Some have their sleep interrupted by problems breathing, while restless legs keep others from getting a good night's rest. Let's take a look at some of the common sleep problems seniors have and some of the simple changes they could make to improve their night's sleep. No matter how old or young you are, all adults need about 7 to 8 hours of sleep per night, but about 40% of older adults experience sleep problems. And those problems can extend into their day, making it hard to concentrate, focus, and perform daily activities because of fatigue. Insomnia is a sleep disorder in which you have trouble falling or staying asleep. It can be short-term or chronic and can also come and go. Symptoms of insomnia include lying awake for a long time before falling asleep, being awake for most of the night, and waking up too early. Insomnia can be caused by many things, including asthma, chronic pain, sinus allergies, and arthritis. Insomnia is also a common symptom of depression, so it's important to talk to your doctor about what may be causing your insomnia and the best course of action to treat it. Another common sleep problem is sleep apnea, or breathing interruptions during sleep. People with sleep apnea often snore loudly, and people who are overweight, male, and have a family history of sleep apnea are at greater risk of developing this condition. Mild sleep apnea can be treated by behavior modifications to lessen sleeping on the back and changes to daily activities or habits, as well as devices that enhance the airways. For moderate to severe sleep apnea, a breathing device called a CPAP is the most common treatment. Your doctor may also recommend weight loss or eliminating medications that depress breathing. Restless leg syndrome is a strong urge to move your legs and can make it harder to fall asleep and stay asleep. Lifestyle changes and medications may help reduce the symptoms of restless leg syndrome, so talk to your doctor about the measures that are right for you. Narcolepsy is a chronic neurological disorder that interferes with the brain's ability to control sleeping and waking cycles. Symptoms of narcolepsy include excessive daytime sleepiness, sleep paralysis, and hallucinations. People with narcolepsy may fall asleep unintentionally during activities like walking, eating, or driving. It's important to talk with your doctor to properly diagnose narcolepsy and to follow recommended medication and lifestyle changes to treat this problem. For many sleep problems, the most effective approach is to ensure what's called sleep hygiene, all the daily practices or routines that can either help or hurt your nighttime rest. These include a regular bedtime, establishing pre-sleep rituals such as bathing or reading, exercising regularly, but not within 4 hours of bedtime, and avoiding caffeine, smoking, and alcohol before bedtime. Talk to your healthcare provider about the sleep problems you are experiencing, and work with your healthcare team on creating the best environment for a safe and restful night's sleep. Falls are the leading cause of injury-related deaths among seniors 65 and older. And falls are also the leading cause of non-fatal injuries for seniors, threatening their independence, mobility, and safety. So let's take a look at some simple ways to prevent falls, so we can continue to live active and healthy lives.
A good start to your fall prevention plan is making an appointment with your doctor, who will need a list of your prescription and over-the-counter medications and supplements you're taking, as these may have side effects or interactions that could increase your risk of falling. Be prepared to discuss any falls or near falls you may have had in the past. This will help your doctor identify specific fall prevention strategies. Certain eye and ear disorders may increase your risk of falls, so be prepared to discuss your health conditions and how comfortable you are when you walk, if you have dizziness, joint pain, shortness of breath, or numbness in your feet and legs. Your doctor may evaluate your muscle strength, balance, and your walking style or gait. Exercise can go a long way toward preventing falls, so with your doctor's okay, try to incorporate activities like walking, water exercise, yoga, bicycling, or Tai Chi into your life. These activities reduce the risk of falls by improving strength, balance, coordination, and flexibility, and they're fun. Now let's take a look at our footwear. It might be time to give those high heels, floppy slippers, or slick-soled shoes a permanent break. They can make you slip, stumble, or fall. Sensible shoes that are sturdy, properly fit, and have non-skid soles are the answer, and they can even reduce joint pain. Now let's take a look around the house. Make sure your stairways are well lit and have switches at the top and the bottom of the stairs. And keep items off the stairs so you don't trip on them. Make sure handrails are secure and you have them on both sides of the stairs. If you have throw rugs, secure them with double-sided tape or Velcro and secure any loose carpeting. Lots of falls occur in the bathroom, so pay special attention to safety measures there. Place a non-slip mat or strips inside your shower or bathtub to help prevent falls. Installing grab bars will also help reduce the risk of falling. Other assistive devices, like a raised toilet seat or one with armrests, a walk-in bathtub, or a handheld shower nozzle for bathing while sitting down, can all make your bathroom routine easier and safer. Discuss these things with your doctor to make sure you're doing all you can to minimize your risk of falls, so you feel more secure at home and better able to handle all the things that life throws in your path. It costs around $600,000 to purchase and equip just one of the 42 fire engines that you rely on in an emergency. Volunteer fire and combined EMS services in Harford County are funded by your donations and a yearly allocation from the county to purchase their equipment, pay their monthly bills, and service their apparatus. Each volunteer organization owns and operates various state-of-the-art fire equipment, and those costs add up quickly. It's a small price to pay for those things that are truly priceless.
Welcome back to Living Well, making the most of your senior years. As we age, our bodies go through lots of changes, and our eyes are no exception. Some of these changes begin in our 40s, while others start to impact our vision and eye health in our 60s and beyond. While we may not be able to prevent most age-related eye problems, the good news is that many of them are easy to treat. Let's take a closer look at how our eyes age and how we can best protect ourselves from eye problems and vision loss. Since your 40s, you probably notice you need glasses to see up close. You may have more trouble adjusting to glare or distinguishing some colors, particularly shades of blue and green. These changes are a normal part of aging. As we age, our pupils become smaller and less responsive to changes in light. That's why we often need more light to read comfortably. Smaller pupils also make it more difficult to see at night, so many older people prefer to avoid night driving. Older adults are often more sensitive to bright sunlight or glare. Certain eyeglass lenses or anti-reflective coatings can address these issues. The size of our visual field, or peripheral vision, decreases as we age, so it's important to be aware of this, especially when you're driving. Turning your head to make sure you're seeing all that's around you will help keep you safe on the roadways. In general, our bodies produce fewer tears as we get older. It's best to talk to your eye doctor if you begin experiencing burning, stinging, or other eye discomfort. As we age, the gel-like substance in our eye begins to liquefy and pull away from the retina, causing symptoms like floaters and flashes. These are usually harmless, but they can also be a sign of a detached retina, which can lead to blindness. So make sure you consult with your eye doctor if you have any of these symptoms. Age-related macular degeneration, or AMD, is a common eye disease among people 60 and older. It gradually destroys the macula, the part of the eye that provides sharp central vision that we need to see objects clearly. It has two forms, dry and wet, and each form requires different techniques to treat the condition. Your eye care professional is your best source of information about treating this condition. A cataract is a clouding of the eyes and lenses and is common in older adults and people with diabetes. Vision loss by cataract is successfully restored with surgery. In fact, cataract surgery is one of the most common procedures performed in the United States today. Diabetic retinopathy is the most common eye condition among people with diabetes and damages the blood vessels in the retina. If you have early-stage retinopathy, your eye care professional may suggest controlling your blood sugar, blood pressure, and cholesterol to prevent the disease from getting worse. For the more advanced stages, you may need laser surgery. Glaucoma is a group of diseases that are all caused by fluid building up in the eye that damages the optic nerve. Your eye care professional can help control glaucoma by prescribing eye drops or pills. Laser surgery is another way to open clogged areas so that fluid strain and pressure eases. As we age, we're all at higher risk of developing age-related eye diseases and conditions. If they're not caught early and treated, they can lead to vision loss and even blindness. That's why it's so important to see your eye care professional regularly to diagnose and treat the eye diseases and the conditions that impact our quality of life. Depression is a common problem among older adults, but it's not a normal part of aging. In fact, most older adults feel satisfied with their lives despite having illnesses or physical problems. But COVID-19 has added to the stress and isolation that can trigger depression. So let's take a look at depression in older adults and find some ways to avoid, detect, and treat this condition.
Depression is more than just feeling sad or blue. It's a common but serious mood disorder that needs treatment. Depression can cause severe symptoms that affect how we feel, think, and handle daily activities like sleeping, eating, and working. Some of the most common symptoms of depression are persistent sad or anxious mood or just feeling empty, feelings of hopelessness, guilt, worthlessness or helplessness, irritability, restlessness, or having trouble sitting still, loss of interest in once pleasurable activities, decreased energy or fatigue, moving or talking more slowly, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening or oversleeping, eating more or less than usual, thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear cause or that don't ease with treatment, and frequent crying. If you have several of these symptoms for more than 2 weeks, you may have depression. Depression in older adults may be difficult to recognize because they may show different symptoms than younger people. For some older adults with depression, sadness is not their main symptom. They may appear to feel tired, have trouble sleeping, or seem grumpy or irritable. Confusion or attention problems caused by depression can sometimes look like Alzheimer's disease or other brain disorders. Older adults also may have more medical conditions, such as heart disease, stroke, or cancer, which may cause depressive symptoms, or they may be taking medications with side effects that contribute to depression. The COVID-19 pandemic has many people feeling anxious, scared, or depressed. Physical distancing guidelines and travel restrictions have also caused people to feel isolated or lonely. There are several factors or combination of factors that contribute to depression. People with a family history of depression may be more likely to develop it than those with no family history. Older adults who had depression when they were younger are more at risk for developing it later in life. People with depression may have different brain chemistry than those without the illness. Loss of a loved one, a difficult relationship, or any stressful situation may trigger depression. If you think you may have depression, start by making an appointment with your doctor or healthcare provider. Your doctor can rule out any medications or medical conditions that can cause the same symptoms as depression. Your doctor may then recommend a psychological evaluation. Depression, even severe depression, can be treated. The most common forms of treatment are medication and psychotherapy. Psychotherapy, also called talk therapy, can help people change negative thinking, change behaviors that may be making depression worse, and help with problem solving and personal challenges. Medications for depression are called antidepressants. They may help improve the way our brains control mood or stress. You may need to try several different antidepressants before finding one that improves your symptoms and has manageable side effects. It's important to talk with your doctor about what to expect when taking an antidepressant and any adverse drug interactions that may occur while taking them. There are steps you can take to lower the risk of depression or ease the symptoms. Try to prepare for major life changes, such as retirement or moving from your home of many years. Stay in touch with family and let them know when you feel sad. Regular exercise may also help prevent depression or lift your mood when you feel sad. Eat a balanced diet to help avoid illness that can bring on disability or depression. And engage in the things you like to do. If you find that you're thinking about harming yourself, tell someone who can help immediately. Don't isolate yourself, even though you might not feel like talking to anyone. Call your doctor. Call 911 or go to a hospital emergency room to get immediate help. Or ask a friend or family member to help you. Or call the toll-free 24-hour National Suicide Prevention Lifeline.
Now, let's take a break from all the stress, isolation, and fear that COVID has brought us. and catch up with our fitness guru, Val Collins. A while back, we visited her in her outdoor swimming pool, where she was combining the pleasure of the water with some strengthening exercises. Let's dive in.
Well, hello there. It's great to see you again. It's Dr. Val Collins, and yes, I'm in the water yet again. You know, sometimes water exercises are also for rehabilitative purposes. Maybe you've had surgery, maybe you've had therapy, or your doctor has just told you that you need to get in and move around a little bit, and you need a little easier starting point. Well, you could sit at the edge of the pool, just like I am, on a step, ground yourself, and do some of the exercises for your limbs to get started. So let's begin with that today. So the first exercise we're going to do is for the upper body. Simply extend your arms, open your fingers to spread your palms, and open and close in a fanning motion. Working the shoulders, working the chest, and working the back. As a variation, you could cross the hands one over the other, and you can also flatten the palms and bring them down toward the steps. You can hold on to the step with your hands and then extend your legs. Either one at a time or at the same time, you can open and close, pushing through the heel with the toes pointing upward. Two at a time, same work, double action. Working through the glutes, working through the inner and outer thighs. And if you want a little bit more of a challenge, you can work the arms with the legs, opening and closing. Another exercise you can do is to bring your hands to the step and curl your legs in. Full extension, either one at a time or both at the same time. So if you found these exercises interesting today, I hope that you will try them on for size. See you next time, and thanks for viewing in.
Nestled in the serene Heavenly Waters Park on the edge of Bel Air is the Liriodendron Mansion, the perfect setting for a memorable wedding, anniversary, or special family gathering. Walk among the gardens or gather fireside. Any time is the right time to plan an elegant event at the Liriodendron Mansion in Bel Air, Maryland. Call to reserve your date now. Visit Harford.
Thanks for joining us on this edition of Living Well. Let us know about some of your favorite activities, passions, and pursuits, and how you're staying safe and healthy during the pandemic. Until next time, I'm Terry Troyer, reminding you to make the most of your senior years.